Hamstring strain injuries remain the most common non-contact injury among high-speed running sports, accounting for roughly 12 to 17% of all injuries. Despite widespread use of eccentric focused prevention programs, incidence and recurrence rates have barely improved within 4 decades. So what's missing? The answer may lie higher up in the kinetic chain at the pelvis. When the pelvis tilts forward, known as anterior pelvic tilt, it increases hip flexion relative to the trunk. That forward rotation lengthens the hamstrings, especially the long head of the biceps femoris, by shifting the ischial tuberosity both superiorly and posteriorly. A recent cadaver study showed that for every 5 degrees of anterior pelvic tilt, the proximal hamstrings will lengthen by about 1 centimeter and the distal hamstrings by about 0.4 centimeters. During the late swing phase, the hamstrings decelerate the extending knee while preparing for ground contact. At maximal velocity, they can experience forces approaching 8 times body weight. Higher degrees of anterior pelvic tilt magnifies this by lengthening the muscle tendon unit, elevating passive tension, and increasing eccentric torque demand. This combination of high strain and rapid stretch velocity explain why most hamstring injuries occur proximally near the ischial tuberosity. Biomechanically, excessive anterior pelvic tilt shifts the hips into flexion, increases lumbar lordosis, and alters gluteal activation timing. This state of pre-stretch means the hamstrings begin each stride closer to their maximal length, reducing fascicle operating range and increasing injury susceptibility, even in athletes with strong eccentric capacity. Recent intervention research supports this idea. A 6-week multimodal program combining manual therapy, core stabilization, and sprint mechanics retraining reduced anterior pelvic tilt by around 5 degrees. For applied sports scientists and strength coaches, this reframes prevention. The pelvis isn't just a passive connector, it's a strain regulator. Integrating hip flexor mobility, gluteal and core co-activation, and upright sprint posture retraining can restore neutral pelvic alignment, optimizing stiffness and reducing strain at the proximal hamstring. So remember, injury prevention isn't just stronger hamstrings, it's smarter biomechanics.